Welcome to the first episode of MediMobile Fireside Chat. It's where we take simple questions and give you simple answers. So let's get started this week. Lauren, help me answer, what is charge capture and why should anyone care about it? We know there's providers out there that are asking this question continuously and they're just not sure. Do I need charge capture? Why do I need charge capture?
So charge capture is the process of clinicians or billers and coders ensuring that they are collecting the revenue for the services provided by clinicians. So in a nutshell, you're making sure that you are capturing all of your charges. It's very important that organizations and everyone within the organization, from the clinicians to the billers to the coders and obviously C-suite, understands the importance of charge capture because of things like revenue leakage. So it's very important to have a process to capture your charges and ensure that they're getting out to the billing system, processed to the insurance companies, and a reduction in denials is very important to ensure that all revenue is collected for billable services.
Outstanding. So what happens when charge capture isn't done well? How does that affect the doctors, the patients, and overall their bottom line?
So when charge capture isn't done well, it can result in missing revenue completely because of timely billing. So clinicians are required to complete their bills in a timely manner in order for insurance companies to pay and charges to be collected from their patients. So it directly affects organizations and practices' bottom line. For patients, if they're expecting to be billed for something that they went to the hospital for or the doctor's office for, and those charges aren't captured timely, then that can affect their finances. And then in terms of the bigger picture of your large organizations, we've seen hospitals close because revenue is not captured. We hear about hospitals, especially teaching hospitals, that maybe struggle to capture their revenue. So it's very important that every single charge is accounted for and that revenue is collected.
Absolutely. I can only imagine all those communities impacted by it if they only had an efficient charge capture.
It's true.
Well, I know this is going to be hard to believe. There was a time before MediMobile. How were doctors and billing teams handling this process?
Rudy, you'll never believe this.
What's that?
Paper.
No.
Stacks of paper.
Oh my gosh.
Just carrying around stacks of paper from one room to the other, to the office, to your billers and coders. I've even heard of them sometimes being sent in the mail. We're talking about potential HIPAA violations everywhere.
Oh my gosh.
So previously, it was paper. A clinician would write something on a piece of paper, or a scribe would write something on a piece of paper, and it was somebody else's job, maybe even the clinician's job, to get it to the biller or coder, to manually enter it into the billing system. And there was truly a lack of reconciliation.
Oh my gosh. Well, I know that you're talking to providers all the time. You're in conversations with them. You're having Zoom and video call meetings with them. They're looking at other charge capture solutions, but what's the biggest difference that they tell you that they see between MediMobile and those other solutions?
The speed and efficiency within MediMobile is huge for clinicians. So we have some clinicians that actually put their EMR side by side to MediMobile, and they'll sign a document or a patient will be registered and they'll see it in real time transition into MediMobile. So that speed of instantly having everything at your fingertips makes a huge difference. Clinicians can immediately capture those charges and not have to wait until the end of the day when everything processes and populates. So the biggest thing we hear is the speed, and then the convenience of having the actual documentation created in the EMR is a game changer, not only for clinicians, but also billers and coders.
Wow, that's huge. So what do you wish more doctors and practice leaders understood about the financial side of healthcare?
If clinicians are not billing or not billing timely, the bottom line suffers. And like I said, we've seen hospitals, even in Texas, shut down because revenue is not being collected. And closing hospitals, that doesn't just hurt the clinicians or the billers and coders inside. Obviously, that hurts the community as well.
Absolutely.
So this is a very large issue that we want to help solve.
Mm-hmm. Well, I'm sure that as you're talking to these different healthcare providers and leaders, one of the things that you run across is they're already using some kind of existing technology in their practices. So how does MediMobile work alongside those existing tool sets that they're utilizing?
So clinicians typically document within an EMR. So what we do is we seamlessly integrate with the facility's EMR, and all of that data that's created within the EMR populates into MediMobile, automatically populating the patients for the clinicians to create the charges for. If we have AI on, we'll add the CPT and diagnosis codes automatically, and then we'll transmit all of the data, the demographics, even the documentation if requested, and then the CPT and diagnosis codes that have been added into the billing system, all seamlessly. You're no longer having to manually enter insurance, demographics, things like that. So clinicians are able to spend more time with their patients, or maybe even go home early.
Oh my goodness, that's always a good thing.
Yes.
Always is. So I know we've had quite a few practices switch over to MediMobile here. You hear about their successes that they have, what's worked for them. Can you tell us a little bit something of maybe someone that recently experienced when they moved from another tool set to MediMobile?
Rudy, let me tell you about this. It's amazing. So we implemented MediMobile with a large organization, and the first 2 months of implementation, they saw a $3 million increase in revenue.
Oh my, that's huge.
And that was $3 million more than they anticipated seeing.
Oh,
because as we know, any transition from one platform to another, there is the possibility of revenue loss because of the transition. No, this very large organization actually saw a $3 million increase in those first 2 months of implementation.
Wow. So why is speed and accuracy such a big deal in charge capture? We hear about it all the time.
So obviously speed is really important. You've got very busy clinicians. So one of the big things that we just talked about was the ability for MediMobile to intake data and automatically populate it to clinicians' lists. We're talking seconds. So clinicians are able to immediately create their charges. They don't have to go back to it later at night, which means they're not forgetting or maybe skipping a night and then having to go back and do research as to what they should be adding. So that speed is very important. The accuracy, so think about the AI, for example. What we do is we review those our system reviews those documents, adds those CPT and diagnosis codes with accuracy. We have a very high accuracy rate with our AI. And what that does is that decreases denials. Again, saving everybody time, because when you have a denial, research has to be done. Was everything documented appropriately? Do we have the information to back up the CPT and diagnosis codes? We do that all for you, and it's accurate. So you're cutting down on the time your clinicians are spending, your billers, coders, everybody within the organization. So that accuracy is key.
That's huge. That's a huge game changer for lots of them. I can only imagine.
Yep.
So if a practice leader is overwhelmed by tech charges, what's your advice for them taking that first step?
So the first step is to get started. We always recommend a rollout schedule. So start with maybe one site or start with one of your specialty groups. And the really great thing about MediMobile is you'll have an implementation team, you'll have a dedicated account manager, and I cannot say enough good things about our support team. So through it all, you have people there that are assigned to the account to help with that transition.
That's phenomenal. That's awesome. They have that one point of contact to be able to reach out to. Now, you mentioned support. Now, the support, US-based support, is that correct?
That's absolutely correct. They're located right here in Georgetown at the MediMobile headquarters.
24/7, 365?
Absolutely. You can call at 11 o'clock in the morning or 11 o'clock at night.
Awesome. That's phenomenal. So what's the one thing you want our viewers to remember about MediMobile and the role of charge capture in healthcare?
We've revolutionized charge capture. We have taken manual entry to population off of the admit discharge transfer feed, then population off of the medical decision-making feed, the notes created in the EMR. Then we transition to Genesis, and we now automatically add CPT and diagnosis codes so clinicians don't have to worry about that. Billers and coders don't have to search documents for hours on end to identify the appropriate coding. Now we've launched the ability to take PDFs, images, and attach them to the correct patient record and also code them. So we're constantly evolving. Keep that in mind. You don't want a static system that doesn't change and grow with healthcare, and we do. We watch it every day to see what changes are taking place.
That's great. That's great. So you're saying they can just take their smart device, their phone, Android, whatever it is, and just snap a picture of it, and then it just appears in MediMobile?
Absolutely. We'll populate the data into MediMobile after they snap that picture. The patient will be there with their demographics and any other information that is contained in the picture.
Wow, that's pretty darn simple.
Yep.
And you're carrying around that device for capture in your pocket already.
Yes. And the really nice thing, because I know people don't want things on their phones.
Right.
You snap the picture, it attaches directly to the encounter, and it's not on your phone.
Wow, that's huge. No security risk.
Nope.
All right, excellent. Well, thanks everyone for joining us for our very first Fireside Chat. We'll be doing these every Friday. If you have a simple question, looking for a simple answer, make sure to reach out to us. You can reach us at marketing@medimobile.com. Don't forget to subscribe and click the like button down at the bottom. We'll see you next week.
Thank you.